Welcome to the She Found Motherhood podcast. It's Dr. Alicia here, and today I'm lucky enough to talk with Dr. Pip Houghton, who is a family doctor specializing in mental health in our pregnant and newly parenting population. Today we're talking about a really important subject, and we're talking a little bit about when birth doesn't go as we expect. So what are we talking about? We're talking about people who have a childbirth experience that does not go as they anticipated, as they planned, and what feelings, emotions, and issues come up afterwards. So we discuss disappointment versus grief versus trauma and how to tell the difference and a little bit about what to do once you understand what's going on in yourself after that birth experience, which was unanticipated or unexpected. So really excited to talk to Dr. Pip about this. This is something she deals with all of the time, and we'll get to it right after this quick reminder.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Welcome, Dr. Pip. We're so excited to have you here. Dr. Pip Houghton is a family doctor on the mid-island of Vancouver Island, who we work with very closely because she does a tremendous amount of work with postpartum people around kind of mental health. And she's a family doctor and does amazing things. But I'm really excited to talk to you today about the process of reconciling when your birth doesn't go as you expected. Why don't we get started by Dr. Pip, you tell us a little bit about yourself and the work that you do and what's brought you to that place.
Yeah, as always, thanks for having me. I love collaborating with you guys. You're such a support. I am a family doctor by training. I have a passion and interest for perinatal mental health, which was, and I'm sure people who've listened to your podcast have heard this story before, but for those who are new, just came sort of told from my own birth experience where I just felt very unprepared for a lot of the stuff that happens in postpartum and was quite shocked that as a medical resident in family medicine, I was unprepared for postpartum. Like this is, postpartum is bread and butter, family medicine. And yet I felt completely taken aback. So I had already started percolating on, like how to help prepare patients better for this. And then I had a friend go through postpartum depression, and witnessing her experience of postpartum depression and healing really prompted me to learn more and sort of grew this little area that I love to work in. A bit about my work life. And I love to prepare resources and be available to people online to share sort of evidence-based content in this space and destigmatize maternal mental health. And I've got resources on my website for anyone who's looking for more support or information. And then as a mom, I've got 3 little boys, 4, 2, and 8 months. So it's crazy. I'm currently recording this from my closet because they're all home unexpectedly on a snow day. And I've got lived experience with birth not going the way I had hoped, and pregnancy loss and breastfeeding complications. So like yourself, I've walked this journey, so I can speak to it both personally and professionally.
It is amazing how woefully unprepared even us medical professionals can be, let alone people who've never seen or been involved with or supported people through birth and postpartum for the experience. And you can prepare all you can, and I think information is good. And obviously Sarah and I know as well, are very firm believers in getting the information and getting good quality information so you can set realistic expectations. But that only goes so far. And then once you're in it, you're just like, oh my goodness, because that's really inspired the work that Sarah and I have done as well, because none of our experiences were what we expected. And we were not at all prepared, even as healthcare providers, for those experiences and for the postpartum. I think this is really important. And this conversation is really important as well. So I'm really happy to have you and happy to have this conversation with you.
Yeah. Yeah.
So let's jump in.
Yeah. Well, let's jump in. So, I mean, the key message of what we want to talk about is that sometimes birth just doesn't go the way we hope. And I know you guys talk a lot about crafting sort of birth wishes or birth intentions with the mindset that, sometimes wishes don't come true, right? We go into birth having, especially our first births, and I am super guilty of this myself, with all the education and experience I had. I went into birth thinking, well, I'm fit, I exercise, I've done hypnobirthing, I've done all these things, I'm healthy, so I deserve to have the birth that I have crafted in my mind. Um, and that didn't happen to me. And, I don't think there was birth trauma per se. I don't think there was birth trauma, but immediately after my birth, I remember having all these feelings and not knowing what they were and not feeling overly happy or joyful after this long awaited baby had arrived and being quite confused about how I felt. And it wasn't until a lactation consultant who was helping me with breastfeeding said, it's kind of like grieving the birth experience you wanted. And I remember just being flabbergasted. Grief. Of course it's grief. Why hadn't I thought about grief? I'm in medicine. I know about grief. I know about complicated grief. Why didn't I realize that I could grieve an expectation or a hope or a wish? So that's why it's important to talk about this and sort of normalize the ways we can feel when our wishes don't come true, when birth goes differently than we imagine.
For my first birth, my birth plan was like, short of us both dying, like the most horrific. I was like, I'm going to end up like having a failed forceps and needing a stat C-section and having like a horrible post-op wound infection and blah, 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 blah. Like I just set my expectations so low and I had a vaginal delivery and, it wasn't perfect, but it was pretty great. And I was so surprised. And then by second, I was like, oh, I'm just going to have a quick vaginal delivery. I've done it before. No problem. Gonna go home like an hour later, and I ended up having a stat C-section, and my child was in the NICU for 3 weeks. So it's and exactly those feelings of what just happened here, even though I was prepared for that and I'd set myself up for that expectation the first time, the second time I had not. And it's just so interesting how our emotions and our bodies kind of react to that. And we don't necessarily, especially in that sleep-deprived postpartum state, don't always recognize that. And I think that's a big
Hmm.
piece of it, right? You're exhausted and you're not coping at the best of times, and you have this new human being you're trying to care for, right?
Yeah. And I think as care providers, we don't always help our patients realize what's happened to them. And I think that's for a few reasons, and I'm saying this from a perspective, I don't deliver babies, but I have a lot of colleagues and friends who do. And, I talk to a lot of people in this space and I talk to a lot of patients in this space. And I think as care providers, sometimes we forget to name the way that our patients may feel after a birth experience. And one of those reasons is perhaps we actually expected those outcomes. If we could see the writing on the wall that, this induction was going to go end up being a C-section. And so for us, it's not overly unexpected. And we forget that for the patient, it's pretty unexpected. And so there may be feelings associated with that. So we may just forget actually to name that for our patient. And then I think sometimes we worry that in naming harder emotions, we're going to make it harder for the patients. So instead of taking a moment to say, hey, that birth was pretty tough. If it were me in your shoes or if it were another patient in your shoes, it would be pretty expected to feel some grief or disappointment. Instead of saying that, what we often find ourselves saying, and what we often hear as people who've gone through a birth experience like that is, the most important thing is mom and baby are safe. And that irks me and it irks the patients because it is an important thing, but it is not the most important thing. Birth and entry into motherhood and parenthood is a becoming. It's transcendent. It's a huge shift in your life. You're going, I want to say that first time, you're going from one way of being to a completely other form of being. You're welcoming a human into the world. You're welcoming a new version of yourself into the world. And if that transcendent experience goes differently than what you imagined and hoped, that can cause disappointment. It can cause grief. And in some cases, it can cause trauma, depending on the circumstances. It's really important that we help our patients understand and name how they may feel when birth goes differently than they imagined. And even just remember to ask the question, how was that birth experience for you? Is there anything that happened that you don't understand, that you weren't expecting? Anything I can clarify for you? And that opens the door to have those conversations. I mean, those conversations, it doesn't mean you're accepting blame for things going differently. It just means that sometimes things don't go the way we hoped, and we have to roll with that.
And I think a big piece of the puzzle is you and I had a conversation not so long ago, probably 3 months, 4 months ago, around kind of grief versus kind of quote unquote birth trauma. I'm using that quote unquote because there's a definition for it. But I think a lot of
Mhm.
people misconstrue the grief of that lost experience and their birth not going as they would with birth trauma, which there is an actual kind of clinical diagnosis around that, PTSD, post-delivery.
Mhm.
You're 100% right. We don't know how to label that properly, either as patients or as care providers. But since your conversation, I've actually started having that conversation postpartum with people who I knew, had a C-section, had forceps, whatever it was. You know what? It's okay to grieve the loss of what you had hoped for and expected. And that doesn't mean that you still can't have joy with your new baby,
Mhm.
right? And like Brene Brown talks about these holding two opposing emotions at the same time. And it's
Mhm.
really hard, right? And
Yeah.
you're fighting it. And so I think it's okay to recognize that you can love your baby and be so joyful that they are healthy and they came out healthy and you came out healthy. But you can also at the same time be grieving the loss of what you had hoped for in that experience. And the birth experience, the
Totally.
childbirth experience is one of the most impactful things that us as humans go through, period, end of story. People, unfortunately, there's more impactful things that have happened in their lives that are not necessarily positive. But I think from that perspective, we as care providers have a responsibility to recognize that. Because those of us who deliver babies all the time, we're so blessed to be able to do that. But it's something we see all the time. So we sometimes forget that for
Mhm.
our patients and our clients, this is like a once or thrice time in your lifetime experience, right?
Mhm.
And yeah, it's just an interesting kind of dynamic there between care providers and patients and different perspectives going into that experience as well. So,
Yeah,
yeah.
absolutely. I love what you're saying because you're highlighting one of my favorite pieces of advice when you're navigating emotions, and it's to embrace the and. Like there's no I'm just sad or I'm just grieving. You can be joyful and grieving. That balancing of emotions is so important. For some reason, we often believe we can only feel one way, but there's always an and there. The sooner we can name those emotions, we can tame them. If you can name it, you can tame it. And one of the kindest things you can do to support your patients is to help them understand how to name their emotions. And this is something that historically, as humans, we have not been good at doing. There's all these toddler teaching courses to help our toddlers learn how to name their emotions and to help your toddler say, I feel frustrated. When I feel frustrated, my body feels this way. We need to do that for ourselves, right? For the longest time, it's been sad, mad, happy. And, that's all it is. The sooner we can learn how to spread those emotions apart a bit and embrace the and between the different ways we feel, the healthier we'll be emotionally and in our bodies. All feelings are valid. They all matter. Yeah.
And Sarah and I put together a free online birth plan course to enable pregnant people and their support person to kind of think about what those different scenarios in childbirth might be and what their birth preferences is the term that we use would be if those came up. So it just gets people thinking a little bit more about what the possibilities are, get to know their pregnancy, and if questions come up, they have that opportunity then to ask their care provider around that during their regular prenatal care as opposed to in the midst of what sometimes is a bit of a situation.
Mhm.
So that childbirth. So certainly are very much proponents of kind of knowledge is power and prepare yourself and think about the options should those things come up, just because then it actually like sets your brain that it might be a possibility versus going
Mhm.
in with a traditional birth plan of this is what I want. Here you go. Thank you very much. which is
Yeah.
really unrealistic that actually happens in the vast majority of cases. Hope it is. Again, it's that hope. That's what you would like to happen. But if something else comes your way, what would your preferences be in those situations? So, and we'll post that in the show
Yeah.
notes below because it's a free course, and it's pretty short, but it just helps you go through that thought process a little bit.
Yeah. And I love I think it's your prenatal course, you have a little video tour of the OR, so that people have an idea of what to expect should they need to go to the OR. And, of course, no one hopes to have an emergency C-section. I didn't want one. But even for myself, having been in operating rooms many times, having assisted on C-sections many times as a resident, it still felt overwhelming to come in as the patient rolled in on the bed instead of walking in scrubs and a mask, right? It's just the lights, the sterility, everyone gowned and ready to go. It's scary. So having a little bit of a concept of what that space looks like at least takes the edge off of some of that uncertainty.
Yeah, totally.
Hey, Sarah,
Yes, Alicia.
do you ever find that people bring in their birth plans to show you in the office and they're not even hitting the important points?
I do. And I think that they don't even consider all the options when really we often don't have any idea of what to expect going into labor.
Agree. So what we did was we put together a free birth plan download, but we also put together a little course about how you can fill it out, talking about what the real purpose of a birth plan should be and how it can really help you have the best birth you can.
We've got an area that covers your medical history and your pregnancy, and then we've got a section that helps you walk through and figure out when you might accept certain interventions. Not just yes or no, but at what point and at what stage in your labor and birth experience.
We go over some examples through case studies to help you get an idea of what this could look like. And we also think it's really important to use your birth plan as a jumping off point for conversations with your partner and your provider. And we talk a little bit about how you can start doing this with our birth plan course.
Absolutely. If you're interested in learning more, head to our website, www.shefoundhealth.com/courses.
See you there.
Why don't we go into a little bit about kind of the definitions, I guess? What are we talking about? So kind of talk a bit
Yeah.
about kind of disappointment.
So you mentioned Brene Brown. So she's got a lovely book out called Atlas of the Heart, where she breaks down all the emotions in the human experience. And the section on disappointment is lovely because it explains it so succinctly. I mean, essentially, without getting too verbose about things, disappointment happens when expectations are unmet. And sometimes we can have realized expectations. So we expect to not need an epidural, and that goes unmet. So we have disappointment. Sometimes we have unrealized expectations. And so those are sort of the expectations that percolate in the back of our mind that we don't really realize we're weighing heavily on until they don't happen the way we expected to. And so that can cause disappointment that we're not prepared for because we didn't even know we placed value on that thing to begin with. So in the birth space, we, go into birth thinking like, okay, any outcome is possible. I'll be happy with any outcome as long as my baby's healthy. And then unexpectedly feel a lot of disappointment when we require an induction or whatever it is, not realizing that we placed a lot of value on a natural birth. So courses like yours where you can explore sort of what you value in various circumstances can help to separate out where those expectations are so that the disappointment doesn't catch you off guard if it doesn't go the way you wanted.
Yeah, totally. I know. I love that book,
Yeah.
that Brene Brown book. I read it.
I know, it's beautiful. It's a beautiful coffee table book too. Yeah. Grief is the big one that I like to talk about because it was the thing that so surprised me postpartum that you kind of have the notion that, well, grief only happens when someone dies. No, grief happens when there's a loss, and that can be a loss of someone we love, like in a death. Grief can happen when we don't get into the university we wanted to get into, when we expected family to show up at Christmas time and they didn't, right? Like there's all sorts of losses that can occur that trigger grief. And just like, tangible losses like someone passing away, the loss of a birth experience can also trigger grief and, wistfulness and wanting and wishing for things to have gone differently. And this is, again, something we can help our patients name. And grief in particular is an important thing to name and help people appreciate because, as most of the time grief follows a particular course and the feelings slowly resolve as we process and we come out okay. Sometimes grief can become complicated, which can lead to depression. And in the postpartum period, we really want to avoid grief going unrecognized because we don't want people to end up in a postpartum depression if we can help it, or if we can alleviate some of the risk of postpartum depression, let's do it. So helping people to name where they're at and what they're feeling is one of the first things you can do to potentially protect them from depression later on.
And that
So this
doesn't have to be a
matters.
care provider. That can be your best friend, can be your mom, your
Totally.
aunt, your husband, your partner, your older kid, whomever, right? Having those feelings validated is so important.
Yeah. And if you are listening to this as a friend or a care provider or one who knows a pregnant person, really try very hard to stifle the urge to use the "at least you and baby are healthy" statement postpartum, because it makes it really hard then for the person to come forward and say, well, actually, no, I'm still not happy with that. Hold space for them and give them the opportunity to explore how they're feeling. Just that alone can heal and process any emotions they weren't expecting. But if you kind of shut them up with well, be grateful, you're healthy, how are they supposed to move forward? They get stuck in that grief without any avenue to speak up. And there may be shame associated with it if they're not feeling grateful that they and baby are healthy.
Yeah, totally. Another beautiful difference, guilt versus shame by Brene Brown.
Yeah.
Guilt, I've done
Yeah.
something bad. Shame, I am a bad
I
person.
am bad.
So
Yeah.
good.
Yeah.
So good. Okay, so we've talked a little bit about disappointment and we've talked a little bit about grief. Can we
Mhm.
touch a little bit about trauma? Because I think this is a really important one to kind of differentiate between the other two as well. Because there's a lot out there around birth trauma. And again,
Yeah.
it's a diagnostic, I hate to use that term, but I think a lot of people maybe think that they've got trauma when it's grief or vice versa, or not recognize the trauma and don't know what's going on within their body or their mind. Again, kind of more information out there.
Yeah. So, I mean, trauma is, I don't want to say trendy, talking about trauma a lot right now. So there's a lot of information about trauma out there. And I think in some cases, like myself, people may find themselves post delivery wondering, is this trauma? Is this grief? What am I feeling? So it is important to name it. And after you and I had booked this session to talk about, feelings after birth, I happened to listen to an excellent podcast with Auntie Kolber. She's the author of Try Softer, and she's got another book coming out, and I cannot remember what it's called. She speaks a lot around birth and parenthood and motherhood. And she had such a lovely definition for trauma, it's so simple. And I'm going to repeat it. And I just want to credit it to her. It, any event that overwhelms your nervous system's ability to cope is trauma. So simple, right? We don't need to get into all the nitty gritty and bits and pieces. When your body is overwhelmed by trauma, those sensations of trauma get held in your body. And so, how this differs from sort of a negative memory is that you can remember something bad that happened to you. I can remember the time I was snowboarding and injured my knee and couldn't finish the day of snowboarding. And that sucks. I remember feeling sad. I remember feeling angry and disappointed. I don't feel trauma in my body around that. Someone who has been to war, who experienced violence, who experienced threats to their safety, when they experience triggers similar to those events, will feel trauma in their body. So they'll have episodes of re-experiencing. So that might be nightmares, that might be flashbacks, high levels of anxiety. There may be avoidance of triggers to protect themselves from feeling that trauma in their body. So it's different than just reflecting on a memory that sucks, right? You feel that trauma in your body. And again, Andi, this podcast I recently listened to, she talked about big T and little t trauma. And this comes up in a lot of spaces around trauma. And I think it's a great way just through traumatic experiences, because that big T trauma is what we typically imagine when we think of trauma is the person coming back from war being in a car accident, even some birth experiences could fall into big T trauma, where we feel our safety was threatened, the safety of the people we love was threatened. Uh, we feel a complete loss of control or powerlessness. Those would all be sort of those big T trauma events that you would typically read in the DSM, our book we use to diagnose psychiatric conditions. But then there's these little T traumas, and these are little things that happen throughout the course of our life that still overwhelm our nervous system and still impact our body's ability to cope and still get stored in our body, even though they're smaller. It's not war, but maybe it's bullying in school. Maybe it's something that happened in your birth where you felt your autonomy was taken away. So it felt like you didn't have a lot of say in whether or not you had forceps or C-section, right? Your safety wasn't necessarily threatened, but you had a sense of powerlessness, and now that's stored in your body. And so those events of trauma may come up later in life when you're exposed to similar triggers, right? Like in some cases, it might be going back to your maternity care provider, might be the trigger. It provoke flashbacks for you. It might bring tension into your body. It might make your heart race to the point where you don't want to go back anymore. It certainly can come back up in subsequent births when we're planning for, baby number 2 or baby number 3. It's really important to consider that in our patients, both during the birth at hand and in future births. And for people listening who wonder, have I had a trauma exposure? How do I process this? Go talk to a trauma-informed counselor. They'll help you figure it out, right? The stuff we need help processing because it's a lot.
Yeah. And we as care providers, well, Dr. Pip is, but the most of us are not actually trained in this at all. At all. I don't remember learning about, I guess, PTSD, but again, it's that traditional PTSD from those war exposures or, but certainly in the birth world, we definitely are not very well educated in this. I agree with you. I tell people and their support people who are there with them to go see a counselor, debrief around this. If you have any kind of concerns or sadness, or whether it's disappointment, whether it's grief, or whether it's big or little T trauma, go process that, because it is going to come back at some point if you don't actually take some time to process it. And for partners who've seen their, birthing partner go through this, especially those big T traumas, you're scared you're going to lose the 2 most important people in your life, your partner and your soon to be baby, right? Like that's huge. Even though you're not physically in danger, your whole livelihood is. And so I think it's really important to remember that for both sides. And we both grieve and we both process differently. And so sometimes we just need to take our own time to do that, because otherwise we can look at the other person and think they're not grieving the appropriate way. And it can cause even more tension in the relationship.
Yeah. Yeah, absolutely. And I think the other important piece is to know your story when you're going into birth, because there may be pieces of trauma from your background that might be provoked by pregnancy. You come from an experience where body image was a source of trauma for you growing up, and now your changing body and pregnancy is re-triggering. Has something happened in your life before where you felt powerless or where you lacked control or autonomy? Labor may trigger that for you again. Labor is not something you can control. You at times will feel powerless to the contractions happening in your uterus. And so that may be a trigger for you. So knowing your story as you navigate your prenatal care and getting some support through counseling even before birth could be protective for you to try and, avoid re-traumatizing yourself. And, for care providers who look after patients who may think like, wow, this is a really minor thing. I'm very surprised my patient feels traumatized by that. It's important to remember that one moment of trauma in birth is probably not the whole story. There's probably many pieces of little T trauma that already primed their body and their experience to be traumatized in birth. And it's not speaking anything to the care you provided. It's speaking to the story that they're bringing to their labor and birth.
That's a great point. I had a lovely, lovely patient who was brave and told me her story at the beginning of her pregnancy, and she'd been previously assaulted, and was concerned around kind of birthing vaginally and what that might do in terms of triggering. And she was, going through counseling. And so as the birth got sooner, she kind of asked about an elective cesarean section, thinking that that might actually help her. We explored that together, and I referred her to the obstetrician, and they had a wonderful talk about, you know, how that might go and what it looked like and risks and benefits. And she made the decision herself to try to have a vaginal delivery and felt really empowered by having that choice and being in control. I think she actually went on to have a cesarean section, as 30% of the population in Victoria does. But I think her experience was so much better because she'd had those opportunities to have discussions, to make choices, to feel supported throughout the way. And I think when people don't have that opportunity or feel like it's taken away from them, or things happen so fast and you just can't process it, is when those kind of traumatic events really come into play.
And I think that's an important point too, is that sometimes in birth, things happen so fast that the care team can't appropriately brief you on what is to come and why, because the priority is your safety. And in those cases, as the patient, feel very empowered to ask after the fact, what happened to me? And it might be next day, it might be 2 weeks or 6 weeks or 8 weeks later. What happened to me? I need help understanding. And as the care provider, it's important to remember to offer that to the patient as well. And someone recently told me that they experienced a uterine rupture during a trial of labor after a C-section. And the person did not understand what had happened or why. Everything took place very, very quickly. But the obstetrician called her 2 weeks later and said, I just wanted to check in and make sure you understood what happened and answer any questions. And she felt so cared for by that action. It didn't even occur to her to ask the question, but once it was offered to her, she had many questions and she felt so cared for by that physician who took the time.
What a wonderful story, but not always the case. So
Yeah.
sometimes we as like I offer that to the patients who I feel have experienced trauma, or they talk to me, either debriefing with myself or with the colleague who's actually there at the delivery. But oftentimes, if we don't know that you're experiencing trauma, we don't know to offer that too. And so it's part of it's
And sometimes we're just stuck within the confines of the healthcare system, and sometimes it gets missed. And it's not that anyone is trying to neglect that care. Sometimes it just gets missed because the healthcare system is what it is. So again, as a patient, if you feel like you need help understanding, please ask. Your care team cares for you. They want to help you.
And we also want to do, all of us are in here to support patients. Like that's why we all came into medicine, is to care for people and to improve their outcomes and their lives. And sometimes we don't realize how or why we do things affects people in the way it does. I have I'm amazed by my patients all the day, but a lovely patient who was well prepared going into birth. She took our birth course, and we have a whole thing about informed consent in our birth course. And so she ended up with a vacuum, which was not the issue. Her concern was that when her care provider came in, they had a learner with them and didn't properly introduce or ask if the learner could be present. And so she fed that back to my colleague, who's her care provider. And my colleague said, you know what, where do you want to go with this? She's like, I think I would just like that care provider to know how it affected me for some feedback. So my colleague fed that back to the care provider, and the care provider had no idea. And she took that in and took that as learning and is going to work on that in the future. And so I think that the patients, by just giving that information, can really improve the care of the people around them. Sometimes you have to be very brave to give that feedback, and you have to be in a safe space and feel comfortable with your care provider. But can actually be, when done appropriately and in a well-meaning way, can actually be really impactful for people in the future. So just remembering that we do like that feedback given in an appropriate way. It's very useful, right?
Yeah, absolutely. Because the goal for all of us is to make sure patients feel safe and cared for. And so those bits of feedback, they're helpful.
They are.
Yeah.
So why don't we recap? We chatted about a lot today.
Yeah. So, key takeaways from this conversation, I think number one is that all feelings after birth are valid. And the more we can name how we feel, the better we can tame how we feel. So we can't work and process through tricky emotions if we can't identify what the emotions are that we're feeling. The work around that to identify how you're feeling and getting support in that process if you need it through counseling. There's of great CBT skill programs out there that can all help you identify the way you're feeling and how to process. Be key message number one. And then I think for providers listening is your role in helping the patients name their feelings so that they can tame them is really important. And sometimes all you have to do is just open the door to the conversation. How did you find that birth? Did it go the way you expected? Is there anything you have questions about? How can I support you in processing what happened? It sounds like you might be grieving an expected birth.
And I think you made a really good point. If we have a good understanding of what people's hopes are before they go into their birth, we can potentially recognize that a little bit more effectively after the birth and ask the question, hey, you had a cesarean section. I know you were hoping for a vaginal delivery. How are you feeling about that? Yeah.
Yeah. And sometimes just helping the person name it. I do this with my 4-year-old all the time. It looks to me like you're feeling angry. It sounds to me like you're feeling disappointed. Help the person label it. And maybe you're wrong. Maybe they'll say, no, I'm not feeling disappointed. I'm feeling angry. And great. Okay. We've named it. You're feeling angry. Let's talk about it. Yeah.
Totally. Totally. And again, even for people who aren't care providers, you can ask that same question. Hey, I know you were going into that and hoping for a vaginal birth and you had a cesarean section. How are you feeling about that?
Yeah.
Right? Wonderful support person question to ask to start those kind of that therapy. Untrained talk
exactly.
therapy, but talk therapy nonetheless. Sometimes telling your story is just very therapeutic.
Yeah, it's called narrative therapy. It's a form of therapy. It's really important.
And again, not judging, not assuming, just listening and being supportive.
Holding space. Yeah.
Well, Dr. Pip, once again, you've done it. You're an incredible gift to our postpartum families. Where can people find you?
I am Making Mama Well on Instagram and Facebook, though admittedly I'm not very active on Facebook. Site is www.makingmamawell.ca. I have some programs on the horizon for people in BC at the moment. So some group medical visits we're working on around preparing for postpartum. At this time, it is really limited to BC residents and ideally those on Vancouver Island. Follow along. If I find a way to offer it outside of BC for free, I will happily do that. Follow me up on Instagram for more information.
Awesome. Thanks so much. And we will post all of your in the show notes below.
Yeah, great. Thank you.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.